Brachial plexus branches. What are the brachial plexus branches? The long thoracic nerve, which arises from three nerve roots, C5, C6, and C7, gives the long thoracic nerve, which supplies the serratus anterior, and paralysis of that nerve will cause medial winging of the scapula. Here you can see a picture of medial winging of the scapula. Another branch is the dorsal scapular nerve. It comes from the C5 nerve root, and it supplies the rhomboid major and the rhomboid minor. This is a very important nerve. It differentiates preganglionic from postganglionic brachial plexus injury. The preganglionic will have a poor recovery potential, and it occurs proximal to the dorsal root ganglia. You will have rhomboid paralysis in addition to other findings such as Ulnar syndrome and the scapular winging. When an injury occurs to the dorsal scapular nerve, it will cause rhomboids winging of the scapula and loss of shoulder abduction. Then the nerve to the subclavius. The nerve is very small and supplies a very small muscle, the subclavius muscle. Three branches arise from the nerve roots. Only one branch arises from the trunk, the suprascapular nerve. The suprascapular nerve supplies the supraspinatus and the infraspinatus. It comes from C5 and C6. Entrapment of the nerve can occur within the suprascapular notch or the sphenoglenoid notch. The lateral pectoral nerve arises from the lateral cord. It supplies the pectoralis major muscle. Three branches arise from the posterior cord. The upper subscapular nerve, which supplies the upper part of the subscapularis muscle, the thoracodorsal nerve, which appear between the upper and the lower subscapular nerves, and it supplies the latissimus dorsi muscle, the lower subscapular nerve supplies the lower part of the subscapularis and the teres major muscle. The medial pectoral nerve arises from the medial cord of the brachial plexus. It supplies the pectoralis minor and major. The medial cutaneous nerve of the arm and forearm arises from the medial cord of the brachial plexus. The medial cutaneous nerve of the arm supplies the medial arm. The medial cutaneous nerve of the forearm supplies the medial forearm. The musculocutaneous nerve arises from the lateral cord of the brachial plexus. It supplies all muscles in the anterior compartment of the arm and also supplies the lateral forearm sensation. Injury to the musculocutaneous nerve may produce weakness of the elbow flexion and forearm supination. Axillary nerve arises from the posterior cord of the brachial plexus. Axillary nerve supplies the muscles of the deltoid and teres minor, and gives sensation over the shoulder area. The radial nerve arises from the posterior cord of the brachial plexus. It supplies all muscles in the posterior compartment of the arm and forearm. It also supplies sensation over the posterior arm, forearm, dorsal aspect of the radial part of the hand. Radial nerve allows for extension of the wrist and fingers. If the radial nerve is injured, you may get wrist drop. The ulnar nerve arises from C8-T1 nerve roots, which form the medial cord of the brachial plexus. Give sensation to the ulnar 1.5 digits and the ulnar part of the palm and the wrist. It also supplies all intrinsic muscles of the hand, except the 3 thenar muscles and the 2 lateral lumbricals. Just past the elbow, the nerve gives branches to the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. In the forearm, the ulnar nerve divides into dorsal and palmar cutaneous branches. In the hand, the nerve further divides into superficial and deep branches. The superficial branch of the ulnar nerve divides into palmar digital nerves after it passes under and supplies the palmaris brevis muscle. The deep branch of the ulnar nerve innervates the 3 hypothenar muscles, the medial 2 lumbricals, and the 7 interossei, the adductor pollicis, and the deep head of the flexor pollicis brevis. The palmar cutaneous branch of the ulnar nerve provides sensation to the palm of the hand. Finger sensation is provided by the superficial branch. The dorsal cutaneous branch gives innervation to the medial dorsal aspect of the hand and 1 1/2 of the fingers, the ulnar fingers. The median nerve. The median nerve originates from the lateral cord and the medial cord of the brachial plexus. The median nerve supplies all muscles in the anterior compartment of the forearm, except the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, and the 3 thenar muscles of the thumb, and the lateral 2 lumbrical muscles. It supplies sensation to the radial 3.5 digits and the radial palm. Thank you very much. I hope I was helpful with this lecture.